Onorevole Professor Scarecci, Ministero della Salute, Sua Eccellenza Ambasciatore Al-Khoraiani, Sua Eccellenza Altana, gentili dottori Laciano Diacchiono, gentili dottori Muriglioni, gentili ingegneri Sicciadri Sicardi, Eccellenza Consigliera La Roccia, Dottoressa Ferro, gentili ospiti membri delle delegazioni. I'm trying to speak Italian. Prima di tutto vi voglio di dare benvenuto all'Egitto e in realtà la nostra preghiera per la visione della Danto e i suoi frutti del campo della sanità pubblica, argomento di recapita importanza per l'ontabile dei sondi del Mediterraneo. Inquadriamo quindi la visione di questa importanza stabile rotando, auspicando e un persona cooperazione dell'altro di nuovo, un vorace siendi che tenga sempre velocido della salute e del bienestar fisico e mentale delle settimane. Grazie. It's a great pleasure for me to welcome you all here in Egypt at the ministry premises at the UN Suite capital. I hope you get to briefly explore the cultural complex today before lunch. We are delighted to host this roundtable discussion to help advance our cooperation and promote investment in the healthcare field. This discussion is tangible outcome of a very successful visit of the Italian Prime Minister Giorgia Meloni to Egypt last March, and the fruitful meeting with President Abdel Fattah el-Sisi, reflecting their determination to strengthen the economic relation between our two countries. This discussion represents a significant milestone in our ongoing effort to foster joint collaboration and enhance healthcare outcomes in both nations. I'm thrilled to welcome Minister Schillaci in Egypt following my visit to Rome last July and our signing of a memorandum of understanding to enhance our cooperation and partnership in healthcare. In today's interconnected world, addressing global health issues, this requires a multi-layered approach. Egypt has embarked on several initiatives to tackle key health challenges, demonstrating our commitment to improving public health and ensuring access to quality health care for all. In a historic summit in April 2021, held by the African Union Commission and the African Center for Disease Control and Prevention, African member states committed to develop a framework that will enable Africa to manufacture 60% of its vaccine needs locally by 2040. African leaders also committed to allocate a minimum of 5 to 10% of the national budget dedicated to the industrial development to help fast-track the implementation of the African Agenda 2063. Therefore, investing in Egypt's healthcare sector is both strategic and beneficial endeavors. Our strong economy and favorable investment climate provide a solid foundation for growth and innovation in Egypt's Vision 2030. Egypt remains the gateway to Africa and the Middle East, providing access to a large consumer market and numerous trade agreements. Our focus is particularly on targeting the people in most vulnerable situations. By adopting projects with measurable social impacts, we aim to contribute substantially to universal health coverage. By doing that, we started by initiatives which we call it 100 Healthy Lives Campaign and Decent Life Initiative. And this is launched by President el-Sisi at the beginning of his second term in 2018. In addition, the Universal Health Insurance Project, which is a landmark reform, has already delivered over 37 million medical services to citizens on its first stage. And I listened to my colleague, His Excellency the Minister, when he mentioned about going to digitalization of the healthcare system as regards to unified health patient filing. We are doing the same at the same time. So it will be a very good opportunity if we do it at the same time with similar companies. So please, we need to get all the information about IT companies working in the Unified Medical Health Records, the electronic medical records, so that we can introduce them to our system also, that we can share with that. So strengthening health system remains a cornerstone of our strategy, and we have mega projects that we can share with our colleagues from Italy. The investment in Egypt offers vast opportunities to both national and international investors. And I think the freedom of transfer of foreign currency without restrictions and various incentives, including comprehensive approval, which we call it the golden license for strategic projects, make an investment more friendly. Additionally, Egypt's strategic location and trade agreements provides an ideal gateway to numerous markets. In conclusion, we believe that the collaboration between Egypt and Italy in healthcare and life science holds an immense potential. Together we can harness our shared experience, resources, and innovations to address global health challenges and improve the lives of our citizens. Thank you once again, Your Excellency, for joining us today with the esteemed delegation, and thank the Ambassador for organizing such an important meeting between Egyptian companies and their counterparts in Italy. And we're all looking forward for the productive discussion between our two teams. Thank you, and the floor is yours.
Good morning, Excellencies, distinguished guests, colleagues, ladies and gentlemen. I'm really honored to be today in Egypt as the Italian Minister of Health. In particular, I would like to thank my colleague, the Egyptian Minister of Health, His Excellency Khaled Atef Abdel Ghaffar, as well as the Embassy of Italy in Cairo and Ambassador Peroni. They made possible to set up this wonderful opportunity to further intensify our bilateral relations in the field of health and medical science. Egypt and Italy already cooperate bilaterally as to health and medical science. A number of understandings have been in place to promote collaboration in many fields, in particular thalassemia, blood banking and prevention programs, with a focus on exchange of competencies and experience, training of healthcare workers and capacity building. On top of that, action plans have been in place for collaboration in the fields of oncology, screening, diagnostic, treatment and prevention, liver and kidney organ transplants, communicable and non-communicable diseases, and health management. Training of specialized healthcare workers has been going on in the fields of pediatrics, neonatology, cardiology, oncology, health governance, and migrant vulnerable population health issues, with the collaboration of Italian universities, institutes and hospitals. Among the cooperation projects implemented so far, for instance, I would like to cite the collaboration between the University of Sassari in Sardinia and the Egyptian Minister of Health in order to improve the nursing skill and medical assistance in Egypt, which involved about 4,000 nurses. Similar initiatives could be designed now also in other fields, taking advantage of our respective ongoing programs aimed at improving and updating the delivery of health service in both countries. On our side, we are ready to share knowledge and experience as to the mainstream of lifelong prevention in health-related policies. Given the current constraints as to fiscal resources and the aging population, we believe that a target investment in lifelong prevention will be essential for achieving a durable social and financial sustainability, also by harnessing innovative digital solutions to improve healthcare delivery. In a lifelong perspective, we must support the promotion of healthy lifestyles as the main tool to reduce the occurrence of cardiovascular, chronic degenerative and oncological disease. Technological advancement, innovation are improving the quality and length of everyone's life. Thanks to digitalization, we now have the capacity to better analyze data, allowing for proactive solutions to diagnosis, prevention and cure. Telemedicine, early detection of risk factors, target therapy for cancer are only some examples of how digital solutions empower individuals to take control of their health while reducing the burden on the health systems. Similarly, artificial intelligence is becoming a critical factor in the health sector as a powerful tool for health professionals in detecting diseases faster and in designing personalized medical treatment. We have, however, to carefully assess risks and opportunities to optimize the use of biomedical artificial intelligence. At the same time, we are planning to leverage our decades-long experience in the collaboration between the public sector on one hand and the private health providers on the other in order to design and maintain a more efficient network of health facilities. It's a big and ambitious program, but we are confident to be able to deliver over the next few years if along the way we manage to ensure a widespread buy-in by our citizens and by the community of health professionals. As to our bilateral cooperation, I think that also the pharmaceutical, medical device and biotechnology industries of Italy and Egypt should increase their collaboration thanks to public and private sectors' interest and involvement. Egypt could represent indeed an important platform for local market and exports in Africa, the Gulf and Middle East region. The Memorandum of Understanding that Farmindustria and the ETS Pharma Academy and the Federation of Egyptian Industries have seen really represents an important step in the right direction. Allow me to underline that Farmindustria represents about 200 member companies which compose our pharmaceutical industry. That's it to say 70,000 highly qualified employees and more than 50 billion euros production value in 2023. This market is currently undergoing an expansive phase with a very strong synergy between public and private sectors. This relationship is a key to ensure proper functioning of a regulatory system that has the main objective of guaranteeing high standards of safety and efficacy of the products while also focusing on making the clinical evidence a fundamental tool to raise the level of quality of the device available for our national test system. In this context, it is worth noting the presence in Italy of 11 manufacturers with branches in Egypt. We have registered a total of 1,059 medical devices, most of which are related to the production of devices for cardiovascular system, general and specialist medication and urogenital systems. Also, upgrading of Egypt healthcare facilities should involve the increasing cooperation in hospital management, hospital design and healthcare professional training sector. The Ministry of Health remains at your disposal as the entry point to facilitate the new partnership. On the regulatory side, let me underline Italy's constant engagement in both domestic and the European Union activities. Synergies between the political level and the administrative level are necessary to pursue a dual objective: harmonize the internal regulation with the aim of making them more coherent with the European Union environment, to protect Italian centers of excellence in order to enhance their international role. Recently, at least, the Egyptian Drug Authority has become an associate member of the International Coalition of Medicine Regulatory Authorities, the leading global forum where regulatory authorities address current and emerging human medicine regulatory challenges. This achievement confirms the increasing solidity of the Egyptian regulatory system and its potential role in the international arena. On the other hand, it's with a touch of pride that I recall the role of the Italian Medicine Agency as a facilitator of such an appointment at the ICMRA, and I look forward to increasing our cooperation also in this field. Thank you again.